Attendance has been taken. Okay, can I get a motion to approve the agenda? Councilors Miller and Pierce, thank you. All in favor? Carried unanimously. Are there any declarations of pecuniary interest? Seeing none, we have no delegations or petitions or presentations, I believe. All right. Adoption of the minutes from the previous meeting. Moved by Councilor Miller, seconded by Mayor Bailey. Questions, comments, errors, omissions? All in favor? Carried unanimously. Business arising from the minutes. Yeah.
Thanks, Mr. Chair. Through you, if I could just get a follow-up in the, it was the Section 7 staff reports over the last minutes when it, the Paramedic Services statistical package. It noted that the Ministry of Health and the Deputy Minister were aiding with the offload delays as the Brantford General is one of the lowest ranked positions in Ontario. Ministry support until resolution has been assured. I know there's been ongoing meetings with the hospital staff and stuff, but can you just give us an update on how the ministry is still or not still involved with these, please?
Through you, Mr. Chair, our most recent meeting was actually last week with the ministry. They have been working hard with the hospital team and our team. There seems to be more collaboration now with their existing emergency management people and the hospital. Their problem or concerns that we have, as has always been stated, is the amount of real estate they have, the influx in and out of current managers. Right now, we see stability with the new CAO, Bonnie. I don't remember her last name right off the top, and the new ER director. One of the other ER directors left about 4 months ago, so they're trying to replace that. So we are seeing gains in our offloads. However, our call volumes are eroding the gains that we see. So it's still utilizing the same amount of vehicles we have, but our call volumes have increased 2,600. They are committed to getting us out the door, but the ministry's not leaving until everything's done. Like the last meeting, we'll say the adjudicator, the person overseeing our section, basically told us that they're not leaving until they're done. They're happy with the gains, but they're not there yet. So they're not leaving until they basically right the ship. This same organization came in to the Juravinsky, and they were one of the worst. Now they're ranked, I think, the top 6.
Okay, I appreciate that, Russ. So, and what I got from that last part of the conversation is not only are they there, they're giving some input and suggestions on things. Then they're not just there as, hey, we're here type thing. You know where I'm going?
Through you, Mr. Chair, the ministry is concerned from our side. So we are having conversations with the deputy minister and also their staff and saying, now we've done the presentation, where do you really think? Where could the input and changes be? So they have a vested interest in doing it. Okay. And again, they keep telling us they're not leaving. And we've seen a change that they basically they've pushed them more to be more innovative of coming up with solutions for us. But the last conversation I had, I think they had 40 or some odd plus openings, and they got a lot of applications, which is a good positive sign for the community in Brantford. But they're just processing, doing the interviews, and getting people hired as quickly as possible.
Okay, thanks, Russ.
Mayor Davis.
Thank you, Mr. Chair. This actually has to do with County admin staff. I just got a message here from Councillor Hunt. She can't get into the meeting. She's going to try by phone. So I don't know how you might, is there anything I should tell her to facilitate that? Okay. So we're on the minutes? Yeah, okay. Related to that, I understand that we're paying, ministry's giving us money to pay for 1 or 2 positions inside the emergency department? Coordinators, nurse coordinators?
Through you, Mr. Chair, the original DOMP, which is a dedicated offload nursing plan, the original amount of money that we received was $146,000 dating back to 2013. Currently, right now, last year in this year's funding letter, we receive over $600,000, I think it's $628,000 annually to help with their staffing, which will equate to, when staffed, a 24-hour backhaul nurse, which gives us 6 beds day and night. And then they also have the original dedicated offload nurse, which now the 146 has been folded in to the 628. That gives us an additional 6 beds in zone 2.
So that's 628,000 per year.
All encompassing, correct.
Okay. And that's not included in our budget.
That is not, we're basically a flow through. We receive the money, the hospital invoices us, and we give it back to the hospital.
And are we getting that money right now?
We are getting that money right now.
Have the positions been hired? They've been backfilled?
So looking at our bill does fluctuate. They're doing their best to fulfill and staff those areas as best as their ability. In the summertime, it was more of a challenge. Instead of being like 30 days out of the month, we may have gotten 22 days out of the month, right? I don't have those stats in front of me, but they do their best to staff those dedicated offload areas that we are paying for. If they do not staff them, we do not get charged.
Okay. So what do we do with the excess?
The excess funds, according to the DOMP original agreement with the ministry, are returned to the Ministry of Health.
How much did we return this year?
Off the top of my head, I couldn't give you an accurate figure, but there are funds that have been returned. We have tried to, through the original agreement, to use the funds. Can we have a supervisor there to make sure that the flow is going? We've asked the questions, and it's solely dedicated to the way the ministry has written the agreement, only for the use of paying the hospital for offload nurses.
Okay, thank you, Mr. Chair.
With that, I'll call the vote on the minutes. All in favor? Carried unanimously. No luck getting Councillor Hunt in?
We're waiting with Spencer here to get her on, but I believe she's on. Oh,
Yeah, I'm online. I'm on my phone. I wasn't able to get in on the link,
Okay. Well, welcome to the meeting.
but I'm here.
Okay, can I get a mover for the staff reports? Councillor Pierce, Mayor Davis. Separations, which items would anybody like to speak to? Councillor Miller?
7-1, 7-2, 7-3. And I think,
2 and 3.
yeah, if we got budget, I think that one as well. 7-5.
And 7-5. Okay. Does anybody want 7-4? And then we'll call the vote on 7-4. All in favor? Carried. Okay. 7.1. Councillor Miller.
Okay, this is the statistical package. Russ graces us every meeting. The 6% of all the calls are no complaints. First question then, when an ambulance is sent out, we invoice whoever uses it, is that correct?
Through you, Mr. Chair, no, we do not. The only invoicing that occurs is when the patient is actually transported to the hospital.
Okay.
The ambulance service does not receive any of those funds. The $45 call goes strictly to the administrative fees of the hospital.
Well, okay, so obviously then anybody that you go for no complaints, there be no invoice. Okay. The only quibble I have, Russell, you give us the numbers, right? Mm-hmm. Number of calls going up and all that stuff. Down the road, maybe when you're, if you ever change some of the things, the only thing I'd like to see is just the calls per capita, because we know the population's going up. And I'm reading that, and I'm trying to work the two in my head, but that would really clarify for me, the per capita. Are we increasing? Are we decreasing? My just looking at the numbers, I think it's decreasing, like, or the call volume going up even per capita. But like I say, that would kind of explain a few things. So other than that, thank you, Mr. Chair.
Councillor Pearson.
Thanks, Mr. Chair. I got a couple here, Russ, sorry. Not sorry, but I got a couple. So I guess it's page 2 of your report when it's got the call response trends, and you've got them all marked through there, and you make a statement. The service has access to new data set for more accurate information on the annual call volumes. The information included in this table has been updated to align with the new information. Do you recall, or do you have some idea as to like how much of a difference was there? Are we talking, you know, was it 1%? Was it 10%? Like I'm just curious with this new, more accurate data. Was it a big difference?
Through you, Mr. Chair, we noticed a sizable difference, especially in the measuring of the code zeros. The code zeros were just basically data we received from dispatch, and a lot of it was manually calculated. Now we're actually getting, when a code zero lasts longer than, say, 5 minutes, we're basically measuring everything now, and the data basically, we've get about, I'd say, 40 times more data sets than we did before. So we can measure ambulance response times, shoot times, right? The number of code zeros, the longest code zeros, the loss of time, as you've seen in previous reports, how many hours we are losing in offload delays. And if you notice the data now, the trending for offloads is going down, but our call volume is going up. So there's a significant, I would say we were understating our situation in the previous data. Now we have a clearer picture of the new data sets and software that we've received.
Okay, I appreciate that. Now, is it possible with this new way of getting data that we can go back, or is this from now forward?
Now forward.
Okay, appreciate that. All right, then on page 5, where you've got, you just talked about it, call time and offload delays. If we I kind of went back through all of them since 2015, and we were sitting around, you know, 51%, 52%, and then 2019, 20. I'm assuming that's because of COVID. It went down to 43%, then 52, then 62, then 50, and we're at 63% year to date now. I'm curious because on one side, you know, the offload times we think are, you know, even though the numbers dictate differently, it seems to be that we've got this extra offload nurse and extra beds and stuff like that. So it should be getting better. Do we know that is is it just a matter of volume that we are putting through, or is it a matter of volume for Emerge as a whole?
Through you, Mr. Chair, what we've seen is our volume's increasing.
Okay.
The hospital's trying to improve our offloads, making us a priority, but they've seen an increase in volume. Like I remember even listening to the news yesterday dealing with Doug Ford's government, that more hallway medicine, right? Longer wait times, more people seeking out family, they don't have family doctors, aging population and stuff. So it's a combination. So the improvement that the hospital is trying to do, and right now we've got, I would say, one of the best partnerships we've ever had with them, but now they're trying to anticipate, like, if we go up, say, 2,500 calls, that's an extra almost 200 calls per month that they're trying to handle from us, which works about another 3 or, I would say, another 6 per day with us alone, not including the other people seeking out medical attention at the same time. So yes, the numbers have gone up, and this, if you look at the one page where it says 2023, our average offload times were 48 minutes. Now we're back up to 54. The first 6 months of this year were awful, right? But now it's trending down, especially if you look at how much time we've lost in Emerge. Up until June, we were over 1,100 hours. Now in July and August, we're trending down to think like 833 from 1 month, and to when we took this snapshot, 633 lost hours. So it's almost like cut in half.
Okay, no, and then if I could, Mr. Chair. So, you know, and part of that, you know, if we add on top of that, and I'm a huge advocate of the community paramedic program, like we're talking potentially that could be another 5,000 calls annually added to that if we did not have that. I think we spoke about this last time, but that's not going anywhere, correct? They're adding more into that. They understand the how valuable that is, and that's gonna continue on and maybe even ramp up a little bit more.
Through you, Mr. Chair, it's still grant funding for
Yep.
the community paramedic program. your number about 5,000 diverted calls, the overall program avoids people, A, seeking out new family doctors to go and get their urinalysis and blood drawn and everything else, right? This is being done. The flu clinics, right? Seeing people from home rather than taking up that extra space with family doctors or calling a merge, right? So the diversion could be 5 times that, or it could be 5,000, what you said. The community paramedic is a valuable asset. It's almost, I don't think I want to say it in this sense, but it's almost like replacing the old VONs, right? Taking care of that side.
Okay.
And the government continues to provide us additional streams of money, additional amounts of money, but we're right now to the point is staffing's an issue. They give us all this money and we don't have the staff because the province is short of paramedics. So we're all stretched really thin. We try to jump on any revenue source that we think we can handle and manage throughout the community. But there's going to be a point until we all get healthy in the province with paramedics or trained people. That's going to be our next roadblock right now. And like Glenn's trying to, our other deputy chief is trying to do an afternoon program to do that. But again, staffing and 911 side, community paramedic side, right? It's a little bit of a challenge.
Okay, I appreciate that. Just a couple more, Mr. Chair, I promise. And then on page 13 of your report, in the last paragraph there, it talks about the table above, and then it states here you're evaluating opportunities to enhance capacity across evaluating opportunities to enhance capacity across jurisdictions is required to meet the growing needs of the community. Can you just elaborate on that statement a little bit? Like, what do you have thoughts already, or is this the discussions just starting on this going forward?
Are you talking, sorry, through you, Mr. Chair, are you talking ideas and innovative ideas we have to handle our offloads and all of our problems right now? Or are you referring to a specific chart? So,
sorry about that, Russ. Yeah, I should have. For system usage, when you talked about the number of ambulances and with us being over 100%, potentially the code zero, I'm assuming it hooks into the code zeros, but with the service levels up now, it's just, like I say, it's the last paragraph on page 13 of your report there. I'm just wondering, is this something, have you come up with any ideas to this point, or is it still, around the table, or?
Through you, Mr. Chair, for the last couple of years, I've worked on a plan that is basically innovative throughout the entire system. And I've been working with our general manager and previous, Michael Bradley, the previous CAO. So currently right now, I come to council and I says, and I'm just going to paraphrase this at a very high level. May I have $1 million for another 8 more people and an additional truck? That current system right now, I could ask you for $5 million and we'd have to play catch up, right? Just to get ourselves healthy below the 109%. My innovative idea is taking all the existing bank time, stat time, vacation time, any other time that we currently have in our system to the tune of, well, I'm just going to use a round number of $3 million. I come to council and says, I would like $2 million, where 50% of the province would provide you that extra $1 million. I could take that $5 million lump sum, and currently our staffing during the day is 10 during the day and 6 at night. I could put on 4.5 24-hour ambulances and provide the coverage during the day to 17 ambulances and down to 8 at night. When people call in sick, our complement that we've approved for our response is 10 and 6. So I could have 8 people on vacation, off sick, injury, and still have a complement of 15 and 9, right? Rather than currently what we currently do right now.
Right.
Part of it in the capital is our overall response time project that we evaluated the overall, basically our long-term budgeting was 2016. This is what we're looking for next year, but it's taking an additional $1 million request from council and making it basically 7 more ambulances during the day and 4 more at night, rather than, can I have $1 million and I'll split that $1 million for a day car and a night car. So it's never been done. However, in the ambulance service side of things, what other services do is they bring in floats. So there's always 4 people there. People call in sick. We maintain our staffing. This would be similar to the OPP or talking to Chief Binkley in the city of Brantford, right? They staff for 32, right? And they can go down to four or six people for sick vacation, whatever the case is. It's not compromising. It's almost like the same float position. We're taking it the other way of putting 7 more vehicles on during the day, which would bring us, I think my calculation, down to 68% capacity doing that immediately as of today, and costing us $1 million rather than 5.
Okay.
And I'm sorry, I was just trying to make it as simple as possible, trying to follow the numbers, but the original outlay of the $2 million, the province will give you 50% of that back according to our current model.
Okay, thank you.
So that's how I would like to address our current situation.
All right, thanks, Russ. And a final comment, Mr. Chair, on the page 17, when it talks about lost vehicle hours, and you kind of alluded to it. If we break it down, we're at almost 26 and a half days lost for offloads this year. That's scary. Like, and I, as I've said all along, Russ, I appreciate what you guys are doing, and it's kind of, you're in a tough situation because you can only do so much to get them in and stuff like that. But hopefully those numbers are being, I'm going to circle right back to the beginning with the minister. Hopefully the minister is seeing those numbers, that we are losing 26 and a half days in the first 8 months of the year because of offloads.
And the cost associated with those.
Absolutely. But that's it, Mr. Chair. I appreciate that. Thank you.
Seeing nothing further on 7, well, no names.
Thank you, Mr. Chair. The community paramedic program, so you have to sign up for that or be referred. Is that correct?
So you, Mr. Chair, are you signing up for the funding from the province or somebody that wants to get into it?
Well, so for example, I'll get to the core of it, which, and I've said this repeatedly, the problem is we're not effectively managing the demand. There clearly are a number of calls that really do not justify an ambulance. There are calls that people should be going to a walk-in clinic or seeing their family doctor. In some ways, we look like we're a walk-in clinic on wheels. And I understand the community paramedic program is designed to deal with some of that, but you have to be kind of registered in that program, referred into it, correct? Like, you can't get it, you don't have a call come in and decide, oh, that sounds like something the community paramedic should handle.
Through you, Mr. Chair, I will say, Mayor Davis, you hit the nail on the nose. To get, first of all, our 911 side will refer people as they go to their houses. But the way the agreement is written between one ministry to the next, our 911 dispatch cannot refer a community paramedicine to respond to a call. So the 911 side and the community paramedic side is completely divided with basically a brick wall between them. If we showed up on scene and saw somebody with a stub toe that didn't need to go, we can't call the community paramedicine to come over and take over that call or take them to a walk-in clinic, right? They do not allow our ministry 911 dispatch centers do not allow the other side of the fence to dispatch our community paramedics.
Yeah, I got to tell you, Mr. Chair, I just find this incredibly hard to understand because another first responder, police, I mean, they deal with this all the time. Like, for example, if you call in because someone's broken into your car overnight, you're not going to get service in the next half hour. You might get service that day, maybe the next day, because police services, they look at the calls that come in and they allocate the available officers based on a priority system, a rating system of how serious the incident is. I find it really mind-boggling that when it comes to paramedics, something similar isn't done, because otherwise, if you're responding to every single complaint, maybe it's a stubbed toe, and you're taking the person to walk-in clinic, well, all you're doing is you're generating a demand for your paramedic service that it's really not designed for, and extremely expensive. We're seeing that in the budget. Budget increases of 25%, which are not sustainable. They aren't. Sorry, Mr. Chair, I'm expressing a great deal of frustration because we've seen this problem again and again and again. And there doesn't seem to be any kind of effort to really deal with this in a way that properly cares for people, but make sure that we're not using the paramedic system for something that's really not designed for, really not a cost-effective option to deal with.
Through
those
you,
issues.
Mr. Chair, our community paramedic deputy chief did write an extensive letter to MPP Bulma, understanding their frustrations of why the 911 Ministry of Health could not dispatch the community paramedicine and solve some of those problems. And we did not hear a response back, or he says he's looking into it. I can't remember. I did not see the original letter, but there was a letter drafted to basically saying the frustration that our 911 dispatchers cannot take it upon themselves. I'm not putting blame on them. They've got their marching orders to dispatch the community paramedics. Niagara Region has a unique system. They were part of this trial 10 years ago, and they can self-dispatch, and they have a nurse in their dispatch center, and they have a physiotherapist there, and all these other services that can go out. Currently, right now, we are tied to our current 911 system and their rules. We have tried different ideas. We've tried different venues. We've tried different things to not utilize our ambulances as much as possible. As I said, even as far as writing the MPP, but we have not been able to change it. And this is the same frustration throughout, I would say, a majority of other services across the province.
Well, Chief, what would you do if we as the governance committee, and being mindful of the interests of the taxpayers and knowing we have other services where costs are increasing and we don't want to give our residents tax increases of 8, 9, 10% a year. What if we said to you, we're going to increase your budget based on inflation and growth and maybe add another % or 2. In other words, cap you out, give you a spending envelope and say, operate within that. What would you do?
Through you, Mr. Chair, I would operate it, but what we would do is we would be finding that a lot of our additional expenses, because we'd be, for responses, be relying on our neighbors to respond. We do not control the calls that come in, so we would still have to respond and run basically a deficit, because all vehicle movement, all call volume movement is put upon us through the Ministry of Health and the 911 Center. We're just trying to meet the demand of our community because of a inequitable or weak healthcare system currently right now, that when people don't have family doctors and all that, right, we're basically the last safety net. And in a way, I don't want to apologize, but we're doing our best with the resources that we currently have to meet the needs of the community. And we've worked through education saying don't call 911. But if that's all you gave us, then other services would be shortfalled. Like I would love to come up with like that innovative plan I had that you're saying a 25% budget increase from what I'm asking for. My innovative plan just put additional vehicles on, meet the response times, and lower the budget demand that I have on this group, rather than just saying, can I have $5 million and I need 4 more ambulances? My idea puts more ambulances in the community, puts less stress on our current paramedics, and provides a higher quality of services.
Well, Mr. Chair, I would say this, that, you know, we have a healthcare system run by the province. We really have no control over it. They, in their funding levels, they maintain that kind of disciplinary, that fiscal discipline, knowing that where the stress is on the system falls on the paramedics. They know that because we're more responsive and can address budget deficits by sending bigger bills to the property taxpayer, maybe there needs to be a way of sending a message to the province, which is we've had enough of it. We're not going to be the patsy, the budget patsy anymore for the healthcare system. And at some point, we're going to have to make a decision that we just simply can't spend anymore, and using that as a way to send a message to the province, because evidently they don't seem to be listening to the requests we make to make the system more efficient. So I'm sorry, Chief, I'm expressing my frustration, but I'm frustrated with the whole system because I hear it every year, and it seems there's no solution other than continue to send large bills to the property taxpayer.
Through you, Mr. Chair, I'd just like to respond. we see your frustration the same way. And I've been sitting in this community for 24 years with the ambulance committee, with yourselves, and basically being the chief for the last 7. Our innovative idea knows that I just can't keep asking for $5 million for 5 more trucks. This innovative idea, I've worked through some of the numbers already with the general manager, with our finance people. It's easier for you to provide me $1 million or $2 million, but you get 50% back rather than asking for 5. So we're trying to come up with innovative ideas because, again, the ministry is not hearing, and we're basically the safety net for the community. We're just trying to make this place a better place for our paramedics and the community without asking always for additional funds.
Okay. The mayor's question sparked a couple questions for me. If someone stubs their toe and they call an ambulance, if they insist on going to the hospital, can the ambulance say, no, you don't need to go to the hospital, it'll get better in a few days? Or do they have to take them to the hospital?
According to the way the current system is, you would have to take them to the hospital upon their request.
Okay. And you talk about this new system you'd like to implement. Can you implement that with the funds that you have currently and add an ambulance or 2 without increasing the budget?
Through the models I've ran, using the existing money, no, because we would still incur the overtime because we don't have the extra, we'll say, cushion to allow the people off. So currently right now, just using it, I have 10 vehicles, and during the day, right now, every one of those vehicles that people are sick or vacation time or need time off, I have to backfill with the current system we currently have. By using those additional funds and utilizing all the funds for sick and vacation and training and everything else, the $3 million is a round number, and adding the other 2 to it, I put 7 vehicles on. I have 8 people call in sick tomorrow or 8 people off on vacation. During the day, I go from 17 down to 14 vehicles. I still provide 4 additional vehicles in the community all the time. So we have 4 better, right? That's taking 8 people off. And even if 2 more people call in sick at night, instead of having 6 vehicles on at night, I have 10. So I'm down to 9. I still have 2 more vehicles servicing the community rather than waiting or relying on surrounding facilities to come and service Brant.
Okay.
Again, I'm sorry, I'm just trying to give you an overview of how we want to utilize or we'd like to utilize funds and not always coming back and asking for millions of dollars every other year.
Seeing nothing further at 7.1, we'll call the question. Sorry, Councillor Hunt.
I just wanted to circle back to the community paramedic program, and I'm wondering if part of the reason is education, that the community doesn't know that, and I don't want to say you stub your toe, but is there a way for us as both councils to promote the use of the community paramedic program instead of calling 911? And I understand what you're saying between the silos. If the call comes into 911, the dispatcher can't triage it as a community paramedic issue. But is there something that we as council can do to do a better job, I guess, of informing the community of the community paramedic program?
Through you, Mr. Chair, any help that is provided by council, by the media, that that basically diverts or refers calls to other organizations, even going into a urgent care system or whatever, we're trying to do that right now by ourselves, to the point of when our crews get there, and if a patient does refuse, but the crew thinks that that person requires a community paramedicine program or could benefit from it, we're already doing the referral. But any help from council, media, or whatever the case is, right, would be beneficial. We've worked with the hospital before. Don't call an ambulance because you're not going to get priority service or whatever the case. We've done those media situations, but any help from either city and or council, city or county council would be beneficial.
Yeah, I mean, because in a lot of cases, especially with seniors, you know, that it's entirely possible that they are already being seen by, you know, whether it's VON home care or a, you know, a visiting nurse or whatever. And I'm just wondering if there are opportunities, because we already have community supports and services seeing these people, to do a better job of promoting the community paramedic programs so that they don't feel that in the case of what they consider to be, now I need help from an ambulance. And even me, I'm sitting here thinking I'm pretty educated, but I wouldn't know how to reach out to the community paramedic program. So, you know, that's what I'm thinking is how do we do a better job, both councils, in promoting that program to our community so that it's utilized the way that it should be. So I guess, for lack of a better word, it's like you have marketing material for the community paramedic program, or how does, you know, how do we spread the word? How do we get that information in the hands of people that are seeing residents already?
Through you, currently the community paramedics have done a lot of media. It's also, I believe, right now currently it's on the county website. They've done the promotions throughout there. They've gone to a lot of the long-term care or nursing residents and stuff like this to avoid the calls, right? But there's always room for improvement or to better off what we can do out there, working with the city and or county communications department, right? We can work on an action plan.
Okay. Again, just like trying to think outside the box in terms of how we promote the use of that, so we, you know, we're not triaging at the dispatch level, which is unfortunate. Thanks.
Councillor Miller.
Thank you, Mr. Chair. Yeah, no, I totally agree. The city and the county, they both have their communications department. Perhaps, like we put out this guide. I don't know why we couldn't refer it back to our communications department, maybe to get the word out in conjunction, maybe do a joint program. So I don't know if you need a motion to that effect to direct that.
Through you, Mr. Chair, I look upon what the councillor just made or whatever. There's always room for improvement, and taking away from this meeting, right, we can meet with our communications department and they can share with the city communications department to get the word out there. Even if we can divert 100 calls a month or whatever the case is, right?
Yeah.
100 is better than growing at 100 or more calls a month.
But all I'm looking for is maybe to put our communications resources at your disposal for, you know, whatever length of time. A campaign, perhaps we run, like you say, for a month in November, December, January, whatever, but make it coordinated and make it effective. So,
Through you,
like
Mr. Chair, Councillor, we already work with them for like monthly education blasts and stuff with this, right? On winter, whatever the program is, but we can clearly work with them, and I'll have them work with our deputy chief,
okay,
or CP, to get something out.
If I don't see it in here, then we're not doing enough work. That's all I'm saying.
Okay, seeing nothing further, we'll call the question on 7.1. All in favor? Carries. 7.2, Councillor Miller, you asked for that one.
7.2 is response time targets, and I wanted to ask Chief King, through you, Mr. Chair, just a little background. In Muir, there's a little bakery called Van Stratton Bakery. They make great cakes. But even for us in Burford, it's a few minutes to get to Muir, because Muir's a few kilometers on Highway 53 west of Cathcart. Now, if I'm at Van Stratton Bakery and I have a cardiac incident because I've eaten too many of their great cakes over the years, and they call 911, does that automatically go to the Brantford ambulance service? or does it go to the closest one? And if you look at the data, they have Mill Street and Woodstock. I think an ambulance could get there within 10 minutes. If it's a dispatch from anywhere in the county or the city, it's at least double that. So when a call comes in, do they look at geographically who's closest, or do they go by municipality?
Through you, Mr. Chair, when a 911 call comes in, it goes to the central dispatch area. They determine what the closest vehicle is to respond to that location. It's supposed to be a seamless service, but because Oxford County is controlled by the London dispatch, so our dispatch center is located in Hamilton, which has Brantford, Norfolk, Haldeman, Niagara has their own right now, Hamilton, Six Nations. We're grouped in as a group there. They basically dispatch from our resources within our area. But if we don't have resources or a longer travel time, they will reach out to the adjacent 911 center to provide an ambulance for that call.
Okay, but we may have the resource, but that resource may not be the quickest. That's all I'm saying. But it sounds like they would be dispatched from.
Correct. It would be considered what they call a call share, right? We would start it because we should be transporting in our area, but the other vehicle may arrive, render care, and if it's not a cardiac arrest as you referred, the other crew will stay there until our vehicle arrives and brings the resident or community member back into the hospital in Brantford.
Okay, thank you.
So in that situation, you're saying that 2 ambulances be dispatched?
It could be from different areas, correct. And, sorry to answer through you, Mr. Chair and Councillor Miller, is depending on the level of care, there could be 2 ambulances being dispatched. The closest ambulance could be a BLS unit or primary care ambulance. And then if the call meets certain criteria, the advanced cares would basically show up as well to render a higher level of care that we've already worked through the tiering process on. To provide the best care for the community member, but that's what we've done for a tiering process.
Any other questions, 7.2? Seeing none, all in favor? Carried. 7.3, Councillor Miller.
That it's the palliative wish program, and through you, Mr. Chair, to Chief King, was that the same program that they reported on in the expositor about a month ago?
Through you, Mr. Chair, that is correct.
Okay, I was impressed because it was a heartwarming story, simply because, yeah, you can't grant a wish of just anything, but what people, I guess, in the palliative program really want are sometimes it's the simple things, right? Like, and the story was about someone just wanting to come home for a couple hours, spend some time with their family and their pets. So I was quite impressed. So, Andrew Wood, is he doing this all on his own time, or is like, it seems he's putting in a lot of time, I guess. Is it all on his off time, I guess, is what I'm asking?
Through you, Mr. Chair, Andrew Wood started the concept about a year ago and worked through the process between ourselves, getting the appropriate approval through the Deputy Chief Glenn Kinane that's in that program right now, thinking that was a gap that was missing. They get to see some of these people in their worst times or long-term create a relationship and providing that extra service. Andrew Wood actually was honored at our base hospital awards ceremony yesterday for this new innovative program for doing it right from our base hospital director, Dr. Miller, and their team. So actually they had a ceremony yesterday. He got an award for doing it. But most of the stuff that he's done is on his own time. And even if like some of the resources that we need, like we need the ambulance to go pick up the gentleman, right? Bring him back to his house and stuff like this, right? We do that in kind.
I just, Mr. Ch, I don't know. I would like this committee to at least recognize Mr. Wood for his efforts, and maybe we could, maybe I'll make that a motion that we commend him for his work and making the community a better place. Looking for a seconder.
Second, Councillor Pierce. Councillor Pierce.
Thanks, Mr. Chair, and thank you for that, Councillor Miller. That I can't say enough about this because this story was about a very good friend of mine, Gary Wright, who is now passed, and that it was beyond words what that did for that family, and I'm sure there's others out there that would would feel the same way, but when you see things like this and you think, oh, you know what, that's a really good idea, you know, and then like I say, for myself, that hit really close to home because it was, you know, it was somebody that I know very well, and it just I was blown away by that. And I mean, when you take Andrew and Curtis, like, I mean, they're two great guys right off the hop, and I mean, to have that sort of representation, and I'm going to call them, you know, they're the younger generation as well, which is great. It just you know, this is just it is something that is so amazing that I just wanted to, you know, say thanks to you and to them, and I think that's a fantastic idea, Councilor Miller, to recognize them, because it was just it was beyond words what that did for that family, and it was something that, you know, we all can't imagine being in that situation. And what Gary wanted to do is he wanted to spend time with his family and his cats, and that allowed him to do that in, you know, in in the worst times of his life, right? And I think this just like I said, I could go on about this, but I'm gonna just kind of hold my emotions here. But I think this is just fantastic. I can't say enough about it.
Through you, Mr. Chair, I appreciate what you're saying about the program. It took a year to up and come and running. We hope it can basically be expanded out to other people that need those needs. But I will pass on to both the deputy chiefs and people in the CP program, Curtis and Andrew, for doing so. And again, our base hospital did also recognize them yesterday. Myself and Deputy Chief Robinson was down at the ceremony, and we have some pictures and stuff we'll be posting on social media. But I think he did an excellent job starting a program. As you said, the newer up and coming. So we should be in pretty good hands.
Wonderful. Seeing nothing further, we'll call the question. All in favor? Carried. 7.5. Draft budget. Councilor Miller, you asked for this to be separated, so you get to start off.
If it's okay with you, Mr. Chair, could I ask it after Cindy's presentation?
Yep.
May I, through you, Mr. Chair?
Yep.
Going back to Mayor Davis's question earlier on about money that we've returned for the dedicated offload nurse, I didn't ask the question then. Did you want to know what is returned?
Please.
Okay, I just wanted to make sure.
Good morning. I do have a few slides, if Briar, you wouldn't mind. Gary, we're just having some issues with connection over here. Okay.
The meeting is not complete without IT issues.
Nope.
The air is human. To really mess things up takes a computer. Yeah, my iPad's not working properly either.
It's down. That's why you can't get on this thing. Let me just talk to Roberts.
Spencer, I'm going to send you slides. Okay, for now.
This is working again now.
Oh, it looks like it's up. Well, I still need your help, but to me it looks like the Wi-Fi is back right now.
I think this should be connected by Ethernet. Okay, so
Should be in there
Where'd it go?
somewhere.
Second one. Okay. Okay, good morning. Thanks for your patience on that. So I am here to present an overview of the Brantford Paramedic Services draft budget for 2025. The first slide just details the budget process as outlined in the County City Shared Services Agreement. So committee's work is to recommend a draft budget and forward the draft budget to the city and the county by October the 1st. So we do have this meeting scheduled today. We also have a meeting scheduled for next week if we need to come back and review any further information as requested by committee today. This slide highlights our work in 2024. So some of the key items was completing the new headquarters lease. We also undertook the provincial ambulance service review, which occurred over the course of the summer, and continue to expand our community paramedicine program services with approximately 12,000 annual patient interactions. Our priorities for 2025 include the transition to the new headquarters. So that will be, as of now, looking to move into the admin space, which is phase 1 of the project, and continuing to work towards completion of phase 2, which is the garage portion of the project. As Russ has been mentioning this morning, we plan to study our response model next year as the ambulance strategic action plan from 2016 was to provide a roadmap to 2025. So it's time to relook at that as the community has changed and we look to the future. We're also continuing collaboration with the ministry and local hospital officials to improve our offload delay times. Our 2025 budget drivers include the new headquarters lease, our annualization of 2024 staffing increases, overall increases to salaries, wages, and benefits, and increase of transfer to reserve to support our capital asset replacement. So this slide is the proposed draft operating budget, for 2025, and it is included in your package as an attachment to the budget report. I will go through and highlight some of the key items in here to provide a little further explanation. Our federal provincial grants in 2025 increase of $568,000 is based on 50% of the 2024 budget. Other revenues of $73,500 are attributed to funding from the community paramedicine program that we've allocated as administrative overhead for staff assisting program operation in various departments. Under expenditures, ambulance administration salaries and benefits increases include the annualization of the 2024 decision package for a commander position, which is budgeted to start July 1st, 2024. The amount also includes an economic adjustment and step increases for staff. Supplies include software support and licenses attributed to increases to annual software subscriptions for access to our data sets. Our insurance premiums are budgeted to increase by $2,000. Contracted services includes $10,000 for external consulting services, which is funds to assist with implementation of service goals and objectives following an employee engagement survey to assist with improving employee morale and improve overall workplace well-being. Medical supplies and patient equipment include inflationary increases to medical supplies and growth in call volume, as well as increases to the laundry bedding contract. Fuel and vehicle maintenance includes increases to the price of fuel, which continues to rise, and also maintenance on our existing ambulances as we extend their life on the road, often beyond the industry standard. And I know we're waiting for new ambulances to come in. There's quite a lag time in the industry on that. Station costs include an increase to the current leases for Henry Street, which will include, which we need to include until that new headquarters is ready. Phase 1 of the garage space is budgeted for the lease to begin in August 2025, which is based on the current construction schedule projections. Our transfer to reserve has an increase to provide adequate funding for our capital asset replacement in 2025. And there is another slide on capital, so I won't spend too much time on that right now. Our paramedic salary, wages, and benefits includes economic adjustments to wages, increases to benefit premiums, mandated increases to CPP, and step increases through wage step progression. Our collective bargaining is currently ongoing, so if committee does have further questions with respect to this, we strongly recommend that we do that in camera. Staffing related costs are attributed to an expected increase in costs associated with meal claims. Meal claims are significantly impacted by offload delays at the hospital. So the base budget overall net levy impact is approximately 1.5 million or 16.6%. And the breakdown between the city and the county is 72.2% for the city in 2025 and 27.8% for the county. So this slide details the 10-year capital program, and which is also included in your report as an attachment. This slide includes capital projects funded through the transfer to reserve. So we have projects including 2 ambulance replacements, defibrillator replacement, stretcher replacements, computer hardware replacement, and tough books. The CAD-Link iPads and 4G replacements are required under a new provincial change and a directive that Russ has been working with the province on. The capital funds for gym equipment is for phase 2 of the new headquarters, which was not included in the lease as they were assets that Grandbridge did not have an interest in. Too far ahead, way too far. Okay. The next slide continues with the capital and reserve forecast. There are some projects on here which may be funded by development charges. This includes the study for the optimum response model. And it also includes, if approved, the additional ambulance as requested in one of the decision packages. So that brings us to the decision packages. We have 3 requests for decision packages in 2025. These are for new positions or services not included in the base budget. The impact on the increase to the proposed base budget on this slide is included, noting that the capital cost of the new ambulance, which I just mentioned, may be funded by development charges. I did highlight the decision package for the 24-hour ambulance on this slide, as the information provided in your agenda package was incorrect on the costings. It only took into consideration upstaffing for 4 frontline paramedics, which would work for 12 hours, but we need 8 frontline paramedics for a 24-hour ambulance. The addition of half a supervisor and 1 commander position are critical to meeting ongoing service requirements and providing supervisory and technical oversight. The current administrative staffing cannot meet service requirements into the future with pressures and calls for service with growth coupled with the significant pressures in the healthcare system. The additional 24-hour ambulance is requested to meet demands of increase in call growth, noting a significant number of code zeros continue to affect the service and ability to respond to calls. With the trend year over year of increasing calls, it is projected that the service's capacity will be overwhelmed in 2025 without the injection of an additional ambulance. So the service's ongoing and future challenges, which we've touched on, I think, in discussion already this morning. One is our provincial funding formula. So that is 50% based on the previous year's budget with no inflationary increase. Our service growth with increasing calls, increase in staffing, and our new community paramedicine programs. The broader healthcare system pressures, including offload delays, lack of primary health care in the community and alternate care, and the impacts that this has on staff morale, and significant pressures on our management staff to meet regulatory requirements and provide adequate staff oversight. And that concludes my presentation. Russ and I are available to answer questions, and we also have our finance staff as well. Thank you.
Okay, Councillor Miller, you can start off.
Thank you, Mr. Chair. I'm going to be brief. It's really not, I don't know. It's a bit of a jaw dropper, this one. We're looking at 16.6% without any of the decision packages, correct? So if we add one ambulance, which you said was 9.6% for operating, we need 8 paramedics. That would just, I'm just asking for clarification, that would bring the increase up to 26.2%. Am I reading that right?
Through the chair, that is correct. The base budget without the decision packages currently is 16.6%.
And if we add one ambulance, and just this, I think this needs to be said. If we had an ambulance today, we'd still be over 100% capacity. Is that correct?
Through the chair, yes.
Correct. Even with it, and then of course we'll probably have a projected call volume increase. Okay, just a comment. Obviously a frustrating situation, very frustrating. And we can take it, we can improve it, we can pass it on to the ratepayers, and at the end of the day, the province won't say boo. You know, we just take it. It's one thing to approve the budget, but I think we need a bit of a longer term plan to tackle this. So, but anyways, I'll leave it at that because, like I said, I hate like hell to just pass this on to our ratepayers who are already struggling with so many other increases, and nothing's being done at the other end. In other words, on the provincial side, in the healthcare system side. And I know we're doing some things, but it always seems like around the edges, right? We're not really getting to the crux of the matter. So, like you say, you got the increase, but at the same time, we better be tackling this somehow, some way. So I'll leave it at that. Thank you, Mr. Chair.
Just through the chair, if I may, there was one note which I failed to mention in my presentation. Staff have been reviewing this for days, and right up until the meeting this morning, just to see if there's anything further that we can do to bring this down. We do think that we may be able to decrease the wages and benefits somewhat. I don't have a figure on that, unfortunately, as I stand here, but I do think we can do a bit of further analysis on that piece. So we do recognize that this is a significant increase, and we're continuing to try and work at it.
Okay, thank you, Cindy. And Mr. Chair, if I used any blue words during the soliloquy, I apologize.
The wages and benefits up 13.9%. What's the cause of that? Because obviously they didn't get that kind of an increase in their wages.
Yeah, so through you, Mr. Chair. So some of that is attributed to our benefit premium increases through our insurance carrier, CPP increases. Some of it's, we do have collective bargaining ongoing. So I think if we want to go further into that discussion, we should probably do so in camera.
Okay, but you're not increasing the wages and benefits by 14% just because we're in negotiations.
No.
There's got to be other reasons for that. Can you elaborate on other reasons for that?
Not an open session.
Okay. Mayor Davis.
I have a request to make. I know I asked earlier this week for the budget increase, the increase on the budget, both in terms of dollars and percentage, going back 5 years. And I think what you gave us was the, I'll call it the municipal portion of the budget rather than the total budget. Can you also give us those same figures for the total expenditures? Is that possible? The numbers you gave us, I think they must have I think they represented, maybe they didn't, the municipal portion. I think they took out the revenue received from the province. Some specific questions. So now I'm now looking at page 9. It's the proposed budget. And I know that the previous sheet said that the issue with salaries was 13.9%. But this says administration salary and benefits going up 33.2% over 1 year.
Through the chair, that is attributed to the annualization of the commander position. So in that section of the operating budget report, that's where that position is, I guess, detailed in that line. So in 2024, that position was budgeted to start July 1st. And in 2025, it recognizes the full year. There will be some offset by provincial funding, but we always know it's a year behind. So that's what that is from. There's also some attributed to step increases through the grid if we have staff who aren't at job rate, and an economic adjustment to the salary grid.
We kind of had a similar issue last year at the city with police services budget, where the request was like 22% over 2 years. And we realized if you get down into the line items, which really you're not supposed to do with police anyways, give them a spending envelope. We gave them a spending envelope that was $1 million less than what they'd asked for. And we didn't arrive at that by going through the line items. We just said, this is what we think our city can afford. And given the increases you've received in the past, we think this is reasonable. We as a governance committee could take the same approach here and come up with a figure that we think, based on past increases and what we think the city and county can afford, just give you a spending envelope and say you got to manage within that. That's an approach. How would you deal with that? Let's say we said that growth and inflation has probably been 6% over the past year. We double it, 12%. That's what it is. How do you deal with that?
Yeah. Through the chair, you know, obviously we'll take direction from committee and we'll work, you know, within the money that you provide. But my caution to that is that, as Chief King mentioned, the calls aren't going to go away. So I think that could lead to increased risk to patient care. If we don't have enough ambulances within Brantford to respond to calls, the last action plan that we did demonstrated that, you know, when you're calling in another ambulance, it typically means that you have a greater response time to that call. And that could compromise patient care. Chief King may be able to speak a bit more to our results on the service review, which looks at, you know, where the service is meeting, or if the service is meeting provincial legislation and requirements. There were some areas where, based on our current administrative staffing, we're just too lean to do, you know, meet all the paperwork requirements, the documentation submissions, and there's a lot of pressure on the current staff team. They're very dedicated, they're very hardworking, they put in a lot of extra time, but at some point we're going to see some burnout, I think, amongst that team, and then I think we're left further compromised just in terms of oversight of our staff and ensuring that we provide quality patient care to the community.
Yeah, but that's often how a province approaches budgeting. They just give their departments, this is the amount you go live within. And it's almost like in the healthcare system, they depend on us municipalities through, let's call it for what it is. It's almost like emotional blackmail, that if you don't do this, people will suffer. And for a healthcare system, that's not our responsibility to fund and provide. And it's, to me, I'm getting really super frustrated when we're seeing increases that are in the order of 25, 30% that'll call for an increase in our mill rate of anywhere between 1% to 2% for paramedics alone. It's like, that's just not sustainable. And in some way, we've got to give a message to the province that we're not going to go along with this any longer. That we are the sort of the escape valve, the relief valve for a healthcare system that's in crisis, and a paramedic system that is in some ways providing a MASH unit for the hospital, though we appreciate all the efforts that they're doing to try and manage that, and really, frankly, a walking clinic on wheels because of deficits and problems in the healthcare system we have no control over, that no one, I think, ever conceived property tax to be used to help pay for the healthcare system. I'm struggling to find a way that we can send a message to the province at the same time taking care of our residents that says we're not going to take it anymore. We're not going to do this anymore. I don't know how we do it, but it sure is frustrating. I think we can all agree on that.
Yeah, I would just like to comment on that. Right now, what we've seen in previous years when we were looking at our statistical chart of about 105% capacity and everything else, right? We chose to, according to the action plan that was presented to us in 2016, is put on an additional 12-hour ambulance every other year. Nobody envisioned the amount of call volume. Nobody envisioned not having enough doctors or whatever the case is with the overall programs. So yes, the provincial government has come up with part of their solution about doing the community paramedicine. But a lot of things, as Mayor Davis pointed out, there has to be communication between the 911 side and the community paramedic side. For the years that I've been here, the solution was not to put on additional vehicles prior to 2015. That's why we did the action plan. Right now, yes, the longer we delay it, and we are faced with a big increase this year, it'll be a risk to public safety. Longer response times, as Cindy said. We saw what happened in 2022-23 coming out of COVID. We didn't expect that spike, but we ended up relying on our neighbors for over 1,990 calls and a longer response times to us. And each and every one of those calls, we have to pay an additional, I think it's $280. It would have, if we did not have some of the agreements in place, that would have been another $300,000 bill. We're trying to make do with what we can. The employee survey has identified the burnout from our crews, that when they come in at 7 o'clock, they work the full 12 hours, they don't get their lunches, our meal claims go up to $60,000. I agree with Mayor Davis that something has to be done, and the rest of this group. Our innovative idea would help us doing that by only putting $1 million compared to $5 million on it. But right now, if we tend or trend the same way we have, as Mayor Davis has asked for figures for the last 5 years, right, we're never going to dig ourselves out of this existing hole. Yes, the province funds 50%, but 50%, I would say we're the most inexpensive service, as you guys have to pay, say, 100% of social services or whatever. I don't know your budgets. But right now we have to, with this action plan and the new response times, right, we have to find a new way of providing the service so the community doesn't have to go at risk.
Yeah.
And at my level, my job is to provide care as requested for our guidelines of registration. I don't have the political clout nor power to change what our existing system is. We can just come up with innovative ideas.
Yeah, to my mind, the systemic failure, besides all the problems in the healthcare system, there's really no really effective way of managing the demand. This is like any kind of organization. You've got revenue, you've got expenditures, and you got the demand. And if you're trying to control your budgets, you try to control and manage the demand. And private industry, it's done through pricing, right? The pre-market. In this situation, obviously we're not doing that, but there really is no way to prioritize these calls. The system's not doing it. And I think if we look to what happened during COVID, I mean, COVID imposed management on the demand for the service. And we saw what happened when there was that imposed on the system. And I think that gives us some insight into what can happen or what can be achieved if you have a really effective way to control and manage the calls and more effectively assign the resources you have to the real priority calls. And at some point somewhere, someone's got to send a message that, like I said, we're just not going to take it anymore. Like, to think that we're going to every year do 25% increases, like that's just that's fiscal insanity.
Through you, Mr. Chair, the province has promised us a new dispatch center, system to prioritize the calls, as you're saying. But they've only implemented in, I would say, a handful of services right now. We've been promised that prior to COVID. We're faced with our reality in our community, and I understand everybody's frustration. I wouldn't want to be the taxpayer that had a 1, 2, 8, 10, 12% increase on an annual basis. We're dealing with what's faced with us at the ground level every day, dealing with our medics and stuff. We look towards your group and guidance on what our next steps are. Innovative ideas, as one counselor said, not advertise, but promote the community paramedics in the community, right, to lessen our call volume. We will look at all other solutions. Right now, our same solution as we've always done is add another vehicle to go below 100%, just to maintain our services within our community.
Thanks, Mr. Chair. Yeah, this is definitely a bitter pill to swallow here, and I appreciate the situation that we're in here, and as Mayor Davis alluded to, our biggest problem is we didn't bring this upon ourselves. This is being forced upon us by the province, and then you take the other half of it, which is our citizens. Absolutely, we want to keep them safe. We want to do everything we can for them, and some of them just aren't understanding that there are options. Speaking of options, and again, I'm just don't take this literally or anything like that, Russ. I'm just trying to read through things here. When we talk about ambulance replacements and stretcher replacements, if we look at our 10-year, like we're talking 2 for next year, but if we look at our 10-year forecast, bear with me just 2 seconds here. Our 10-year forecast, right now we have 8.5 ambulances, correct?
Through you, Mr. Chair, it's 8.5 staffed ambulances, but
Right.
we have
Okay.
a fleet of 20.
Okay, so we got 8.5 staffed ambulances. I know that there's been a delay because there was a couple new ones that we had ordered, and I know there was a delay on them. And if we look back, I don't have the numbers in front of me, but if we look back, we've replaced a few over the last, I'm going to say 5 to 7, even 5 years. There's been some decent replacements. If I look at this 10-year forecast, and for the next 6 years, we're talking 17 ambulances replacements. again, don't get me wrong here. We absolutely want to have our equipment that can get from A to B with no problems. I get that. But if we're in a situation here where we're talking 16% without any, decision packages at all, I guess what I would look to you, Russ, is the fact that, we've got, you said, 20 ambulances. With over the last 5 years, I'm going to suggest probably 5 or 6 of them are newer. Now, I don't know the full longevity of an ambulance, but I would suggest that if we've only got 8.5 on the road per se, and 5 or 6 of those are new, are we able to start pushing these out? Again, we want to ensure that A, the vehicle is safe, and B, it's going to get from A to B and back. But of those 20, is there not ones that we can utilize a little longer? And I know some of them have been stretched already, but is there not ones that we can utilize a little bit longer to relieve, $500,000 in essence for 2025? And I know you can't just push the problem down the road. I get that too. There's got to be a point in time where these need to be replaced. What I'm asking here is, can we revisit it? Because as you stated, up until 2015, 2016, then the mindset was, throw another bus out, to try and get on top of this problem. Again, I would like to circle back to see if in fact there's any of these that we can utilize, even a year or 2 years longer to kind of push that out. Because if we look at the 10-year forecast, 2025 and 2026, that's almost $1.4 million right there, just in ambulances. And then when we get to stretchers, again, if we look over the next 6 years, we're replacing 25 stretchers. To me, that's more stretchers than we even have ambulances total. Again, for 2025 is $272,000. Are there not, again, we don't want them falling apart, don't get me wrong here, but are there not stretchers out there that we can utilize over the next few years that can, save that $272,000? I think, and I appreciate the fact of, and as Cindy alluded to, you guys have been looking at this and going over this, but, I would like to approve some of these decision packages, if not all of them, if we can. But when we look at the reality of that, all of a sudden we're talking 20 some odd % increase here. I think we need to understand a way to reduce some of the 2025, 2026 in order to, if it's the extra, you talk about morale with the staff and stuff like that. I would like to have that commander on there in order to help alleviate some of that. But it's a fact, if we do that, then, the more decision packages we do, obviously it's going to bump that up. So again, I appreciate the fact that this has been looked at and then reviewed, but I would really like to understand, I'm going to call it critical for the replacement of the 2 ambulances in 2025 and the replacement of the stretchers in 2025. As I say, even 2025, 26, if you look at the total of that, that's over $1.5 million, pushing $2 million for that. Just kind of throwing that out there because, yeah, it's I know for the county, it was a very tough rate increase for taxes, and I'm sure in the city the same thing. And like we said, it's a frustrating thing. And Mayor Davis is right. This never used to be a cost to the taxpayer with their yearly taxes. Now it is. That's the reality. I'm a little bit leery. I understand where he's going. Here's your budget. Do with it what you want. But at the end of the day, I think absolutely we've got to be fiscally responsible, and I get that. But when you weigh the fiscally responsible with the health and safety of our community, to me there is no relationship there. The health and safety of the community has got to trump that, in my mind anyway. Yes, we got to be fiscal, but when it comes to health and safety, that has to be number one. So again, I'm just looking at, can we review this? Can we look back at the 2 ambulances that are going to be ordered potentially with the backlog? We're not going to get them for another year or 2 years. You just trying to think of options here. Are there any possibilities of that? Have you discussed that? What are the options?
She pointed at me, so I threw you.
We have
Mr. Chair.
discussed it. Go
Okay.
ahead.
So our current ambulances right now, the goal is 5-year frontline, 2-year spare. Currently, right now, we're running 6 years and 2 years spare, which you see in the budget outline about the overall increase in the overall maintenance cost. So we buy it, we don't, we pay for the other increases on that. Even some of the ideas that you've all discussed here about basically budget increases, Heather's original figure was for one 24-hour ambulance that started March 1st. If we chose to go that route, one of the ideas for cost savings was to be starting the new ambulance on July 1st, right? Which would cut the additional cost almost by 50% because you're starting halfway through, or you could even delay it till October 1st. October 1st is not ideal from what I understand for provincial funding to come back. The stretchers right now, what we're doing right now is the manufacturer's recommendation is every 8 years based on the amount of patient carries that we currently do. So we've basically based that 8-year replacement cycle on it. What we're doing is as we order new ambulances, not replacement ambulances, we're getting the entire package of stretchers built into that. So there's always a cycle of trying to, like when we say we provided the additional vehicle for next year, when we buy that ambulance, it's an entire package, right? So over time, but not probably about another 6 to 8 years, will we realize that every time we buy an ambulance, it is basically inside that ambulance rather than having a capital replacement cost. So we've looked at different ways to extend these out. Like one of the suggestions in previous in 2022, we needed, I think at the time, 18 defibrillators going back that far. So the question was, can we wait? So we cut that in half down to 9. Then we cut it down. So right now, the ones that we've ordered in 2025 are the ones that we should have done in 2022, but we just extended out the life of the ones that we've done. So we've looked at different options. We're always open to additional ideas and suggestions, but right now, we've already pushed our vehicles to 6 and 2 for the front line rather than 5 and 2, which is ideal. We're finding out more maintenance costs are costing us in the long term for these vehicles. Like we've had to replace transmissions. 2 of them had to have engines replaced on our current vehicles, and they were some of the older ones at that time. Sorry, through you, Mr. Chair, like you said, Councillor Pierce, we're not pushing it off till later. Over the last couple of years, we've pushed things back further, and we're just right now trying to play catch up. As you did say, the vehicles we ordered in 2023 have not even arrived yet, and they're coming in October, November of this year in 2024. So whatever we order in technically 2025 right now, let me go back a minute. This plan I have to have 17 ambulances on during the day and at night, I asked the manufacturer of the ambulance service how soon we could get if I wanted 7, say tomorrow. They're not delivering until March, April, or May of 2026. So I don't know if that helps in your overall calculations, but that's where their booking builds into right now.
Mr. Chair, if I could on that point, Russ, I'm struggling with that in the sense that, you know, as you alluded to before, there's overall in the paramedic system, there's a lack of staff, right? So is it just that big of a backlog for ambulances? Is there only like, I'm struggling to understand why.
One manufacturer. So there used to be 2, Crestline and Demers. Demers bought Crestline bought Demers, and we're down to 1. That's all we have currently right now. So is it controlling the market? Is it demand? Is it efficiencies that they put together? We don't know, but that's where the demand is because everybody's playing the catch-up game for replacements.
And sorry, Mr. Chair, and I appreciate that, Russ, but if we think about, let's think about Ford or Chrysler or something like that, they ship off a couple 100, 300 vehicles a day. Is it just a little mom and pop shop that's doing 1 a month? I'm sorry to say it like that, but you know where I'm going here?
It's a huge shop, but they're dealing with, we'll say, 56 services in Ontario alone, not the rest of Canada. And everybody wants 10 a year. That's 560 times that by 10 provinces. That's 5,000 or 6,000 or more demand for all the provinces. There's only one supplier right now that I would say everybody gets 98% of their vehicles from. We don't even go through them for our ERVs. We go through a separate company in Toronto called Roland's Emergency Services, and a lot of fire services use them. But again, if I ordered an ERV right now, one of the little rapid response vehicles, I'm 6 to 9 months off because of their build. It's not like we buy something, it's the wiring, the radio systems, the specialty. That's how far we're behind.
And one last one, Mr. Chair, and I hate to ask this question, but is there only one because the province dictates that? Or like how, why? I'm shocked. Like I might have a new business adventure for us all to go in here or something. Like, why only one?
If you go back in history from the province about 15 years ago, there used to be a place in Toronto called Judson's. Judson's basically ordered all the vehicles for the entire province, had everybody schedule ahead of time, and then the ministry basically dissolved the central buying area, which is Judson in downtown Toronto, and let all the municipalities go out and do their own thing. And it was always a competition between Crestline. If you ever see a Crestline vehicles, they're the ones with the rounded corners. If you get the big square boxes, they're Demirs. Both companies merged for cost efficiency, market, whatever. But yeah, there's only one right now. They're looking at another one, but they just don't currently meet the provincial specs in Ontario. We don't know what they meet with other provinces.
Wow. Okay. Thanks, Russ. Sorry, Mr. Chair.
Sorry.
Second time. Just to comment on what Mayor Davis suggested there, maybe. Because I was thinking the same thing when I'm reading through the budget. Thought, well, what if we just say, here's 12%, do with it what you can. But part of the problem, I guess, is when you put an ambulance on, it's a binary decision. You either put it on or you don't put it on. So that's the only drawback I see with that approach. But I don't know if we could make that work.
To you, Mr. Chair, I appreciate your suggestions, and we're trying to look at anything. And if there's anything we haven't thought of for anybody here, but we're even going to the next step. We 3 weeks ago we started investigating a group called Health Pro. Health Pro is a consortium that buys and is supposed to save money. But they say you could save 1% on one thing, 15% on another thing, but eyeglass case or whatever we have to buy could be 25% more that we pay. So the way the contract works is you must buy 80% of all your stuff through them. If they have a contract with glass cases, even though maybe that's the 20% you don't buy, but you don't see the prices. So we're at the evaluation stage right now where we gave them 20 consumables, 20 capitals, and they show, hey, we pay this. They will not share their pricing with us, but they'll say, you can see a cost savings of 1%, 0.5%, 5% all the way down. Or if you buy defibrillators from them, right, it could be 15% more, right? So we're looking at other options of trying to save money because I can't or willingly want to come back and ask for it. But a lot of the, in my opinion, as Cindy pointed out, wages, software, that $60,000 capital is from the province to upgrade to meet the current needs of the software and the new radio systems they did. So in every one of our trucks right now, we have, we'll say, the old 2G package. To meet the demands of the software, we have to replace the hubs in every one of our ambulances for 4G. The data that we get from the province, which they originally told us that our tough books would be adequate enough to do so and meet all the features, well, whatever decision was, the province didn't go tough book side, they went app size. So now we have to go out and buy iPads to meet the needs of the software for the overall apps that they've given us. So we're, as Mayor Davis said, frustrated. We're as frustrated as it is. Our goal is community, the patient first, but all these other things poking us at the same time puts a greater strain on us.
Mayor Davis.
Yeah, Mr. Chair, I think you told us you have to leave at 11. We do have to go in camera, I think, to approve some minutes. And I'd actually like to go in camera to hear what the issue is with that 13.9% issue with the salaries, which I understand involves personnel matters and thus would be dealt with properly in camera. So I'm going to move a motion that we go in camera for the purposes of approving the minutes of the last in-camera meeting, and two, to receive the explanation regarding that line item, the salaries and that line item in the operating budget, which we're told there is an explanation, but would have to be done because it involves personnel in camera. So
seconded by Mayor Bailey. Before we do that, I had a couple of questions I'd like to ask,
Okay.
if you don't mind. You said we have 20 ambulances, but we staff 8.5. Why do we have so many spares?
Sorry, when I did the 20, it was a combination between ambulances and ERVs.
Okay,
So
how
we
many
have
ambulances do we have?
16 ambulances.
So we got twice as many ambulances as our frontline on the road.
So the 10, and then we have spares that are going out. So this year there'll be 2. The reason we have right now 2 additional ambulances is we're waiting for the replacements from last year to go. So we've just kept them on the road for utilization. So when we get 2 back, we'll be trading in actually 4 ambulances.
Okay.
We've just kept them because we did not know about our delivery date of all of our vehicles coming in.
Okay, so if you have 8.5 ambulances, why 18 defibrillators?
Through you, Mr. Chair, it's not 8.5. We are funded for 8.5 full-time ambulances, but that one ambulance could be 2 day cars. So there's 2 that we would need defibrillators on. So if you're running 10 defibrillators during the day, and then we have the 6 on at night, and the other defibrillators also go in our emergency response vehicles, our supervisor vehicles, some of our community paramedic vehicles. Those are the additional defibrillators that we needed.
Okay. The ambulances responding to 911 calls and the community paramedics, are they on the same radio frequency?
No, they are not.
Can they be?
No, they cannot. That's to the ministry.
Okay.
And this is what Deputy Chief Kinane tried to do to put awareness from MPP Boma that says, this doesn't work, right? Because if our 911 system could dispatch a community paramedicine, as we refer to, and I do not mean disrespectfully than everybody that has a stub toe, that could basically alleviate some of those frontline 911 calls. But the left hand doesn't talk to the right hand. And there's no plan that we're aware of that they will ever do that.
Okay. There's a motion on the floor to go in camera. Mayor Bailey. Yeah, you're one step ahead of me. All in favor of going in camera. Carried unanimously. You want to Communications and business in Canada. Okay, all in favor of 7.5?
Hang on.
Mayor Davis.
I'm going to move that we defer this to next week. I think seeking a seconder.
Second by Councillor Miller.
I was going to make the same motion, to be honest with you.
So, sorry, the motion is to
Defer.
defer to the next meeting?
Well, we have a meeting scheduled for one next Wednesday.
Yeah. Till next Wednesday?
I think we need time to think about what the information we've received today. There's some additional information we need as well.
And also they're gonna look at some of the numbers and see if they can fine tune some of them as well.
Yeah.
Okay. Any questions about time and place on the deferral? Seeing none, we'll call the question. All in favor? All right, 7.5 is deferred to the next meeting. I believe we have no communications. Any other business? We've dealt with the in-camera. Next meeting is Wednesday, September 18th, right here in the council chambers at 1 o'clock. It'll be an afternoon meeting instead of a morning meeting. So we'll see everybody then. We are now adjourned.